The first thing to think about with sleep is that it really loves a good routine. So if you can get yourselves to bed at the same sort of time in the evenings and the night time, and get up at the same time in the morning, and try and be very regular about that, then your circadian rhythm, your body's natural rhythm, and your body temperature rhythm will kind of synchronize together, and sleep really likes that. It gets on really well with that. We kind of mess around with that rhythm, the synchrony of those rhythms, twice a year when we change the clocks, and everyone kind of knows what that feels like, and sort of throws you for a couple of weeks. Good sleepers tend to have really good routines, and they'll go to bed at the same sort of time, and they'll get up at the same sort of time every day and have the same amount of sleep every day. Bad sleepers will tend to sort of have their routines will wobble around all over the place, and they'll have good nights and bad nights. So the first thing to do is to get a really good routine, and a routine that's going to work for you. So you will know how much sleep you want to get. Some people get by on 6 hours, some people need 9. You'll know how much sleep you kind of need to get. If you have had an accident or an injury a fair while ago, 2 or 3 years ago, and you found that you're starting to sleep more since you've been recovering, maybe try and get back to the amount of sleep that you used to get before you had your accident or your injury. We can get into the habit of oversleeping. And if you oversleep, and I think everyone knows what this is like as well, if you oversleep at the weekend, you can wake up and you feel really groggy. It's called hypersomnia. And sleep, I think, is kind of unique in that if you get too much of it or too little of it, insomnia or hypersomnia, it brings the same symptoms. You feel tired, groggy, not really with it. What you need to do is get the right amount for you, but we can get sometimes into a habit of oversleeping. If your injury's been quite recent, maybe you do need a bit more sleep, and maybe you do need to nap a little bit during the day, and I'll come back to napping in a second. That's important for your brain healing process. So if it's fairly soon after an accident or an injury, a few months, maybe up to a year, maybe a bit longer in some cases where the accident's been quite severe, you might need a bit more sleep, and we wouldn't want to restrict that. But if it's been a few years, your brain may have healed, but you might have got into the habit of oversleeping. So we want to try and get you back to the amount of sleep that you needed before your accident. And you could be a short sleeper or a long sleeper. Kids need more sleep as well, so bear that in mind. The other thing sleep really likes is you being tired. Now, I talked about napping a second ago. If you're not tired, then you won't be able to get to sleep. So what we do when we're awake during the day is we build up what's called sleep pressure, tiredness. And then when we go to sleep at night, we relieve that sleep pressure. So in order to get off to sleep, you've got to be tired. It's important to be tired. Sleep needs you to be tired. Now, if you nap during the day, you will reduce your sleep pressure at night. You'll be less tired and it will be harder to get to sleep. So if, again, after a few years of having an accident or an injury, you're getting into the habit of napping in the daytime, try and avoid that. Fatigue and cognitive fatigue are big symptoms and big issues for people who've had brain injuries. And you may well feel that you need to rest during the day, and that's fine. Try and rest at regular times, but try and rest, not sleep. If you can stay awake during the day, but rest if you need to, that will keep your sleep pressure high at night, and then you're more likely to get off to sleep quickly and also get good quality deep sleep during the night. So try and avoid napping in the daytime if you can. Rest, and rest in a room that's not your bedroom. Sit down in a chair in the sitting room, something like that. With the exception, if you've just had an accident or an injury, maybe you do need a bit of napping in the daytime. So if it's a few months or year, maybe a little bit more after your injury, and you feel that you need to nap, then that's important. We wouldn't want to interfere with that. But if it's been a few years, maybe try and get back to the amount of sleep you had before the accident, and also try and avoid napping in the daytime, but rest if you need to. So that's routine and napping. A couple of other things that I'll just leave you with before we draw this to a close. A lot of people think we need to drink a lot of liquid, and actually we don't. We get most of the liquid that we need to survive from the food that we eat. And a lot of people, really common this, they're getting up in the night time to use the bathroom. Now, if you're in that situation, try to restrict your fluid intake in the evening before you go to bed. So in the 2-3 hours before bed, try not to drink too much. If you feel that you've got a dry throat, you can chew gum to keep the saliva going around in your mouth, or just take very small sips of liquid, not too much. And then you can go to the bathroom before you go to bed and hopefully get rid of a lot of the liquid that's in your system. So you're then more likely to sleep through the night and you won't wake up during the night. So avoid fluid intake in the evenings. Alcohol's another one that can interfere with sleep. Try to moderate your alcohol intake. Nicotine is a stimulant that will wake you up. So try and avoid consuming nicotine at all if you can. Obviously, we know the health benefits of that, but certainly in the 2 hours before bed. A bit of exercise in the daytime is really good. But again, you need to cool down before you go to sleep. So if you're eating too much or exercising too close to bedtime, that can interfere with your sleep. So in the 2 hours before bed, try to get away from any eating, any exercise, cool down. And also that includes the use of flat screen devices, which emit blue light, and that can trick your brain into waking you up. So avoid flat screen device use in the evening as well. If you're waking up in the middle of the night and you can't get back to sleep, again, it's quite common. Try and get out of the bedroom if you can and wait until your next dip in tiredness. And a good way of finding out when you're tired is to follow your circadian rhythm, which is a 90-minute cycle. And if you're yawning at, say, 8 o'clock at night, in an hour and a half after that, 9:30, you'll have another dip. And that's a good time for bed. An hour and a half after that, 11, will be another dip. Good time to go to bed. So notice when you yawn in the evenings, and that will be a dip, and then add 90 minutes onto that. So if you're waking in the night, don't panic. It might take you 45 minutes to get into the next dip. Best thing to do, if you don't drop off to sleep within 10 or 15 minutes, is to get up, get out of your bedroom, and only go back when you're tired. And you know when you're tired when you're dipping, because you'll yawn. So look out for yawning and try and get your routine set up around those dips. That can be really useful. Fits with a good routine. Avoid napping. Think about fluid restriction in the evenings. If you're worried or distressed at all, talk to us, talk to your friends, talk to your family, talk to your GP. There's a lot of help out there. All you have to do is look around and ask for it.